Thank you so much. Hi all, I'm Jory Jardin and welcome to the virtual Equality Lounge at Cannes. I hope you've been enjoying it. We are having a discussion today about Hollywood to healthcare, the impact of influencer marketing on improving health equity for patients with type 2 diabetes. And I think the important theme here is also about health equity and how we might even be finding ways of approaching health equity through influencer campaigns. So I'm excited to share some pioneering work in this area from Ambre, Jared, Matt. I would love for you first just to share a bit about yourselves, and then we'll dig into this groundbreaking campaign and talk a bit more about how it impacted health equity and around messaging for type 2 diabetes. Let's start with Ambre.
Hi, everyone. I'm Ambre Morley, and thank you so much for having me here. I am the Senior Director of Commercial Communications at Novo Nordisk, where I've been for just about 13 years. And so I lead a team. I'm very proud to lead a team that manages the internal and external communications around our diabetes and obesity products. And so again, I'm really happy to be here.
Hi, Ambre.
Hi.
Matt, would you like to go next?
Sure. Hi, I'm Matt Lalin, one of the founders of starpower, along with my best friend you see in that bottom left-hand quadrant, Weiss. And I think we've been on the Hollywood healthcare journey for well over 20 years, when many in our space wanted to really define their agency by Coke and Pepsi deals. We saw the opportunity to really lean into an incredibly nuanced space in the healthcare community and really redefine culture in that community. And it's been an amazing journey. And the opportunity that we're going to talk about today about providing voices to the voiceless is something that we're incredibly passionate about and look forward to talking to.
Great, and I'll just round out. I'm Jared Weiss, the other co-founder of starpower, and incredibly excited to be here today. The subject matter is just so important and so timely, just coming off the year that we've just come off of. And the question is, what lessons did we learn? What are we going to do going forward? And I think the intersection that we play at between Hollywood and healthcare is an important one and not necessarily expected. And those like Ambre, and I say it not only because she's here, I'd say it behind her back, that actually are adept at it and are amazing at it, can have amazing results, and excited to share some of our learnings and some of the amazing successes we've had.
Fantastic. Thanks, Jared. And just a brief word about myself. I had co-founded an early influencer marketing company called BlogHer, which is why I'm really excited to talk about this. The space has evolved so much. And I think many of the ideals that we had aspired to as influencer marketers, you've all reached, but it took some time to get there. And I want to talk a bit more about how that process worked as well. Before we get into sort of the tactics of the campaign and how you worked with influencers, Ambre, can you just share a bit more about the campaign, your work with Anthony, as well as with patient advocates?
Well, I think the work that we do on the Get Real About Diabetes campaign was something that was truly organic. And honestly, it started with Anthony. And you have a person who has type 2 diabetes, but who also has a major network television show. So when we first started talking to Anthony, I give him all the credit because it was his idea to integrate his real life diabetes into the show, where we took a step back and said, we don't just want it to be about a television integration. We needed it to be something that was sustainable. And in talking to Anthony and in working with a cross-functional team, like it wasn't just my team, it was a number of agencies, it was marketing, it was starpower, it was so many different people that really just took a step back and listened to him. And at the end of the day, we came up with a program called Get Real About Diabetes, which encouraged people to do just that. And it was in his voice. It was the way that he talked, and it was about things that were important to him that we found were important to so many other people. And the show and the integration into Blackish was honestly just the icing on the cake, because the sustainability of it in talking to people on Facebook and meeting people where they are is really what has sustained the program now 2.5 years later.
And it's interesting because something you just said, Ambre, and with the amazing successful launch of Wegovy is and the same thing we say at Star Power and Real Chemistry is the patient is our North Star and at the center of everything we do. And the beautiful integration but collaboration that made that partnership so special is that we were able to speak to the patient. And again, I keep going back to this voice, to the voiceless, because it was so special, where when you think about it, Anthony is a patient. So whether you're a patient that maybe is not necessarily a celebrity, the definition of influencer in our world has significantly changed. And I think by Ambre's recent work, that really speaks to kind of the evolution of what an influencer actually is in the healthcare community.
Well, I also think that patients listen to other patients. And, as a former journalist, I remember when I was covering healthcare companies, I would always try to find the real story. And that's what you see now so many times, that people listen to other people. They don't want to hear from companies. They want to hear from people. And you're that much more successful if you can find a person that can tell the story better than you can tell the story. And I think that's what's so important when you think about influencer marketing, because an influencer, and you look at really what's happened today with Instagram and TikTok and people who are, really finding careers online, who never would have had this opportunity, Jory, when you were starting BlogHer. This career path did not exist, right? So when you think about, whether you partner with a celebrity or whether you partner with a real patient, you have to look at if the story that the patient has is one that other people want to hear. And then you look at, do they have the appropriate platform that people are going to go to and they're going to follow and they're going to be interested in. And once you have a little bit of the secret sauce, then you can start to create the programs and work with the people to do, unique and innovative programs, which is what we've all worked to do.
And Ambre, the one thing I would just chime in with, to the point of the organic nature of it, and really all starting with Anthony, I think the platform that we were able to give him to really tell his story, right, where he had diabetes for a long time, but he really did not keep it in check. And we gave him the ability, and that's to share that story, which resonated with so many other people and
Yeah.
people in action, right? So without us creating that platform, he was never going to be able to tell that story and connect with so many other patients.
Well, I would venture just one step further, because I think he had told the story before, but I also think sometimes it's about timing, right? Because before, I don't think he had the platform with Blackish or with, some of the other things that he had gone on to do. And so I think the timing has to be right in so many ways as well, because he also had Blackish, he also had a bigger following. And before, when he was telling the story, there was no Instagram, there was no Twitter, there was no, that way to get the story across. And so we have a little bit of luck in there too.
It's so interesting.
I want to actually ask, because we keep talking about voice to the voiceless, but let's face it, Anthony has voice, right? He's got a platform. So can we talk a little bit more about how you've integrated patients into this campaign, and actual, I'm calling them real influencers, because they are actual, they're not famous, but they also played a role in this campaign. And over time, they were brought into this message. Can you speak a little bit more to that?
Well, I think that when you think about the real patients in this, you have to go to Facebook, right? And it's that two-way engagement that I think a lot of companies have struggled with social media, because once you open up the comment section on social media, then it's like, you could be opening up the floodgates. And so it's a balance of, how much do you want to say, because you have to be careful of what you say versus what you get back, right? So we do a lot of engagement there. But I think also beyond the work that we've done with Anthony, we do a lot of work with everyday patients in general. And so we have a patient ambassador program that we have across the entire company. And we've worked with patients for years that have their own social platforms, or they might have notoriety in different areas, that we work with them to create avenues to tell their stories. And in that, we find that we're meeting people online, and we're meeting people at live events who are really touched and share their stories with us. And sometimes we might find somebody online, or we might find someone at a live event and say, hey, you have a story that we want to tell. Would you be interested in working with us? And that's the same thing that we do time and time again, even through our clinical trial programs. After our trials are complete, one of the things that we do is we reach out to some of our clinical trial doctors and ask them if they have patients who would be willing to tell their stories. So we don't take the tried and true pathway, because sometimes you just never know where you might find somebody who has a story to share, and it's one that so many other people can benefit from.
And I think that's when you boil it down, authentic storytelling, whether it's a patient or whether it's someone that has a massive platform like Blackish. I think one of the interesting differentiators, and I'm going to call her a trailblazer in what Ambre's been able to accomplish, because I remember when we were doing this 20 years ago, when we sat with Rosa, right? And we were talking.
No, I'm not that old. I'm not that old. Let's make that 12 years, okay?
Years. It was a little longer
12.
ago.
Every year it gets longer, and I don't understand.
Right. Every year Ambre gets younger. I don't know how it happens.
Every year it gets,
It just happens.
12 years ago. 12 years ago.
It's this authentic storytelling that, as Scarlett Alexa Lalin joins our little panel.
Dad, you know where my blanket is?
In your room. That's real, by the way. That's real. That is absolutely
That is real.
Get real about parenting.
But
get real about parenting.
That foundational, where Ambre always says, I want to look whoever my patient, whoever my influencer is, I want to look them in the eyes.
Not in there.
Okay, go. I want to look them in the eyes, and I want to have a conversation to understand what their journey has been, to make sure that it's authentic and real to what we're trying to accomplish. So we talk a lot about at Star Power and Real Chemistry, we talk a lot about the numbers and the data and the tech. And it's incredibly impactful when you could take this message to a very, very focused group of patients. But if you don't have the right authentic story, you have nothing. And sometimes everyone tries to make influencer marketing incredibly complicated. It's actually incredibly simple if you look at it in that way.
Well, so you make it look very simple, but healthcare and pharma has been historically a third rail, right? It's always been difficult to do influencer campaigns in these areas because they're so highly regulated. So I'm curious. I mean, I remember having to do campaigns in pharma, and it's almost like all the rules around authenticity were thrown out the window because you just didn't want to have an influencer accidentally say something that was, medically untrue. So how did you manage that, Ambre, and how do you qualify these influencers? How do you get them to a place where they can be effective advocates?
Oh, that's a great question. And when I say that we don't do this alone, I absolutely mean this. And I can give you a great example for when we did the first Blackish episode. We didn't write it. Like, it wasn't our idea. And they have probably the most talented group of writers that I've ever seen. And they came up with the title of that episode called A Little Bit of Sugar, right? And you think about sugar, high blood sugar, and that's diabetes. That was all of their idea. However, what they asked us for was the medical accuracy, which we were proud. And, we were kind of like, okay, so who do we give this to? And we had a physician at the time that was a part of our team that really worked with their writers to ensure that everything in that episode was medically accurate. And then we had attorneys who sat down and they said, we don't want any, we're not trying to take over creative control, but we just want to come to the table and talk about what's going on. And I swear our attorneys and our medical team probably, just contributed so much to this. And you don't necessarily think about that because sometimes people think, oh my gosh, here's attorneys and this is medical, and then we're going to run into issues because they're going to want to water everything down. If you have good partners that work with you in the other parts of your business, then they can help make it even better. And to the point where our physician who was on our staff went to ABC Studios and was there for 2 days while they were doing the filming. And when they picked up the pen and were holding it upside down, like she participated, right? And so it just added this level of authenticity that they allowed us to bring that I'm not sure would have happened had we not had this collaborative partnership. And I think that's what made it that much better and that much more of a real, situation in a real episode. But you have to have the partners that will kind of be open-minded and not try to make it less funny and you can still be funny and be medically accurate, but it just has to be medically accurate.
And I would just add in also on the identification, even before we're talking about, micro influencers or, macro influencers. Amber, you're always talking about there's a different level of responsibility when you are going to work in the healthcare space. So that's sort of that's table stakes, right? So understanding that level of responsibility. But we also go through extensive vetting and background checks, and we use a suite of technology to get as much information as we can before we even going to consider working with somebody to really make sure that we understand who we're going to partner with.
That is such a critical piece of this because, we've had instances where we've been really this close to signing and then something happened, right? And you have to be willing to do the work. You have to be willing to do the research, do the testing, and make sure that as a company, you are willing to walk down this path. And Matt can tell you, I am very, very keen on having that whites in the eyeball conversation, right? Because it's not just about, negotiating a deal and making sure that someone is kind of interested. You gotta own it, right? Because I fully respect either if it's a celebrity or an everyday patient, I respect the fact that they are taking the time to do this with us. And I really don't want to work with someone who's not all in, who's just doing it for a paycheck. I want to work with people who believe in the cause that they are talking about. Because if they're just doing it for a check, or if they're just doing it to check something off the box, it's not going to be authentic and it's not going to work. And so you've got to do your proper vetting to make sure that they're all in.
And I think the interesting, maybe what's sometimes lost, is that Ambre and her team at Novo are equally motivated to put in the time and do the work. Because what sometimes gets lost is an influencer is going to share their journey. That's highly personal. That isn't a Coke or Pepsi deal. So they want to know that the key stakeholders at the pharmaceutical company, and whatever company it might be, is ready to also listen, learn, and not just view it as a transaction either. And I think like that word for us, for Jared and I, is like the worst word that you could ever use, because you're entering into a long-term relationship where someone's going to get very personal and share something that's incredibly real to them. And I think sometimes it's a two-way street, that sometimes if the best programs have that mutuality where interests are truly aligned.
I want to shift gears a bit here towards health equity. So Ambre, you belong to an organization, Women of Color in Pharma. I would love to, if you could share a bit more about that, and also about the work that you're doing around health equity.
It's an honor to be a part of Women of Color in Pharma, and we do exactly what it says. I'm a founding member, and we formed back in 2015 because we saw that there was a void in our industry that could support, elevate, network, and really prepare women for the next level in their careers in pharma. And when COVID happened last year, we took a step back and we started to realize that Black and brown people were not facing the disease the same way that we thought they should in terms of following the science, and particularly when it came to the vaccine. So we've taken it upon ourselves to really join the medical community and help educate people around not just COVID, but really the science behind the vaccines, because there is an inequitable, situation between Black and brown people getting the vaccine and understanding why they should get the vaccine. And we're doing a lot of work around that. And even this Saturday, we have a panel that we're hosting that anyone can find out about on WOSIP.org, but really continuing to educate our community around why you should get vaccinated and why Black and brown people should not be left behind in this technology and advancements behind the vaccine.
I can't help but think that the campaign you did with Anthony actually could provide a pathway to how to address health equity. And I've seen this with influencers in the communities who are sharing more about vaccines and are helping to educate and helping to inspire and generating trust. Have you been discussing how you can basically take your work with you to achieving health equity, especially around vaccines?
Well, it's interesting, and not necessarily with what we do with Anthony, but I think there is a strong parallel. If you look at the first show that we did when he was diagnosed with diabetes, his wife was the caretaker, right? His wife was the one who went with him to the doctor and who sat with him and who continued to coach him, who continued to give him motivation, who continued to really be by his side as he went down the journey. And I think where we're going as women in the pharmaceutical industry is kind of being the chief executives of our families and the chief executives of the environments that we operate in, to share that message. And we're working to create our own level of influencers, if you will. And none of us are famous, but all of us care and all of us have networks. And so we're leaning on our networks, we're leaning on each other, and we're leaning on our companies to help us spread the message of making sure that we're not left behind when we get to this herd immunity, and why it's so important that not just you get vaccinated, but your families as well. And we're taking the lead as women of color.
Where do you see, you said women, right? And sort of like the chief caregivers of the household, we tend to be. In terms of influence, I mean, I fully agree that women are probably the most powerful influencers on the planet. But how do you see preparing them? I keep going back to this whole idea around pharma, and there's information, disinformation. How do you break that barrier of what is disinformation to get people to truly understand what the real message is, especially around pharma?
I think it comes down to authenticity, and it comes back to what we're talking about right here, because people will listen to people that they trust. So establishing that trust is so important. And what we do from a WOSIP standpoint is we quote the science and we quote organizations that people trust. So we talk about the CDC, we talk about the Johns Hopkins data, we talk about things that you're hearing that are based on data. Because sometimes if you can break down something really scientific and something really difficult and put it into a way that people will listen to, then that's what it is. And you have to establish that trust. Like, we're not going for, big time main stage sessions. Like, we're training people to talk to people in churches. We're training people to talk to community events. We're training people to talk to people online, because we want to meet them where they are. But at the end of the day, we want them to trust us. And by establishing that trust, that's how we're going to break through.
And another thing that we're doing is the HCPs and the health and just the healthcare professionals tied with the lifestyle influencers. So a lifestyle influencer can have an amazing story to tell, but to the point of authenticity and validity to what they're sharing is pairing them with a healthcare provider to really lean into the science so that you allow the lifestyle influencer to get very personal with what they want to share, while also letting the true expert share the science behind it. And I think that's one of the really special things of more and more programs. I'm going to say, as many as 60 to 70% of the programs that we're now engaged in is ensuring that there's some sort of I always say you mix it in a pot, and you have patients, and you have HCPs, and you have lifestyle influencers, you have celebrity talent, you have the potential to leverage that talent as if they're a media platform on programs like a Blackish, but that healthy kind of culture mix in the healthcare community provides like a very real story, but then also backed up by science through those patients and through those HCPs.
And I think you're spot on, Matt, because one of the things that we do, one of our main messages is, I'm not a doctor, but you should talk to your doctor for more information. And I think, as you look at these campaigns and what becomes successful, you should never, misrepresent the information that you're giving, but it's that much more successful if you have that backing and that surround sound and someone else to answer those questions. You're spot on.
And it's a sea change in our world, because by allowing influencers to be comfortable in what they're sharing, and we always say, like, put the influencer in a position to succeed, you're seeing influencers and celebrity talent almost destigmatize like this. Look at what the healthcare community did in the last year. I mean, it's pretty remarkable what science did. So it's now this total shift where influencers and celebrities are kind of running to this area saying, you know what, I actually have a story I want to share, and I have this platform that you can provide me and scale to go share that. It's really changed Star Power's world in influencers and managers and agents and publicists coming to us versus us kind of trying to find the story, the needle in the haystack. There's a lot of really interesting stories to tell around various disease states.
Because the other thing that people don't realize in the health, in our little, in the behind the scenes world of securing the influencers and helping to come up with the program ideas, is that we typically, it's not just about the paycheck for the talent, right? We need to get them on board conceptually. So when the healthcare company is willing to let the talent, the patient tell their story and live and die by whatever that story is, that's a huge motivator to actually get the talent on board. And that's got to be your truth, and you have to be willing to go down that path. And I think what makes this program successful.
And I think that's what Star Power has done extremely well, is not just, because I know people come out of the woodwork, quite frankly, of, okay, I have a story to tell, but it's also about not just jumping at the first opportunity that comes to you. I think what they have done, and I've seen this time and time again, is that, sure, there could be an influencer and sure, there could be a story to tell, but sometimes it's not the right story and sometimes it's not the right opportunity. And so the level of discernment that you guys have shown over the past few years is almost as impressive as what you've brought to the table, because I have confidence in knowing that you're not just going to drop, any person that just volunteers, to tell their story, that they're going to do their due diligence and research. And so it's something that I definitely appreciate about you guys.
Ambre, we have just a minute, so I have a quick question for you. You all just answered my question around how has influencer marketing evolved. It has clearly changed, but the organizations also have had to evolve to enable this change. So how difficult was it to, or maybe it wasn't, for Novo Nordisk to truly embrace this new model of influencer marketing?
I think Novo Nordisk, like most companies, had to adapt. And so, if you look at where we were 10 years ago to where we are right now, we have to keep up with the changing times. And so we've had some incredible leadership over the past few years who have been willing to get out of their comfort zone and say, okay, we'll take a chance on this. And I think what I've always appreciated about the company is that there have been some things that they've been like, I'm not sure, but do you have the research to support it? And that's the one thing, the piece of advice that I could give to anyone is do your research before you jump into these types of campaigns, because not everything that you do is going to be a ALS ice bucket challenge, or, you know, you can't necessarily jump in thinking that you're automatically going to go viral, or you're automatically, you know, going to have these huge media results. But if you go in based off of the data and based off of insight and you do your testing, 9 times out of 10, you're going to be successful. And for my company, as long as we brought that to the table to back it up, they've been very supportive.
We are at time. Ambre, Jared, Matt, thank you for a fabulous conversation and look forward to seeing you in Cannes next year.
Definitely.
Thank you.
Thank you,
Thanks so
everybody.
much.